Good day, I'm Theodore Henry and this is your JIS News for Friday, November 11, 2022. Hundreds of Jamaicans who have been waiting for years for elective surgeries that were delayed due to backlog in the public health sector and their inability to seek private care will soon see an end to their wait. On Thursday, the Ministry of Health and Wellness signed contracts with 5 private health institutions in Kingston to perform elective surgeries and provide recovery spaces for public sector patients.
Because at the end of the day, this is not a statistic. It's really about people. And people are suffering for years in some cases. 3, 4, 5, I've even seen a 6-year wait for a hernia. It's certainly an issue too if you have to wait for 6 years or 3 years or 2 years that you can't afford it. Because if you could, you would go into the private space to pay for it.
The elective surgeries are being accommodated under the public-private partnership component of the Code Care initiative, which aims to clear the backlog of outstanding elective cases in the public health sector, which were amplified due to the COVID-19 pandemic. The ministry previously signed with 4 private institutions in Western Jamaica to outsource 200 cases under the program. This week's signing is to serve persons in the parishes of Kingston and St. Andrew, St. Catherine and St. Thomas. The surgeries will be accommodated at the University Hospital of the West Indies, Andrews Memorial Hospital, Heart Institute of the Caribbean, Medical Associates Hospital, and Winchester Surgical and Medical Institute.
To date, we have done 115 of those procedures, which is an indication that it can work, and it is working. Most of those, about 85 or so, based on the brief I saw, was done in the West. The reward for this program is to see the relief and the happiness on the face of the patients in their beds.
A total of 2,000 surgeries will be done under Code Care. Just over $1 billion has been budgeted for the program, $80 million to rehabilitate operating theaters in the public health system, $200 million for the private-public partnerships, and $223 million for equipment. The allocation also includes $279 million for nursing missions, $153 million for additional staff hours, $23 million for project management, and $59 million for communications. The Jamaica Customs Agency, JCA, has rolled out the pilot phase of its contactless clearance process for non-commercial imports. The process will eliminate the need for importers and agents to visit ports and warehouses to clear cargoes. Director of Cargo Imaging at the JCA, Kingsley Henry, says the move is part of the modernization process for physical inspection to create a controlled, sterile and secure environment. The aim is also to improve customer service through a reduction in wait time and congestion in the clearance and delivery area.
So no longer do we have to wait 2 days, 3 days, 4 days for you to turn up. We do the inspection and then your agent will call you and say, Mr. Henry, you can come and collect your goods. And that's all you're doing. The goods is inspected based on the declaration that you would have made.
You can watch the full interview with Mr. Henry on Get the Facts this Sunday inside Jamaica Magazine. The application window for the 4th edition of the Innovation Grant for New Ideas to Entrepreneurship, Ignite 4, is now open. It's being facilitated through the Development Bank of Jamaica, DBJ, with entrepreneurs and small businesses having access to up to $7 million. The DBJ is placing strong emphasis on projects or businesses in the categories of climate change and gender, tourism and creatives, manufacturing and agriculture, and software and ICT. The DBJ's Ignite 4 program targets innovative businesses that are seeking to grow and scale up, providing them with grant funding and capacity building support. The Ministry of Education and Youth will be using the Family Connect app and other technology to track daily attendance and respond to student absences. Portfolio Minister Favour Williams made the disclosure yesterday at the Interministerial 2534 School Strategy Partners Summit held at the Rock Hotel in downtown Kingston. She says that with the assistance of technology, the ministry will be able to take more immediate action to get students back into the classrooms.
Right now in our schools, it's a manual process, so yes, you take the roll call and that is there. But by the time that data comes to us at the ministry, it's way late for us to take the appropriate action. I fully know that there may be some limiting factors in the way, but we want to preach to our parents, the adults in the lives of these children, that they have to continue to make an investment in education. You can't just not send the child to school. It's a requirement.
And finally, Jamaica copped 7 awards in the prestigious gold and silver categories of the 2022 Travi Awards. Representatives from the Jamaica Tourist Board accepted the awards at the 8th Annual Travi Awards Gala held recently at the Hilton Fort Lauderdale Marina in Florida. Destination Jamaica was honored with 5 gold statuettes for the overall Best Wedding Destination, the Caribbean's Best Destination, Best Culinary Destination, and Best Tourism Board, along with Best Travel Agent Academy Program. The country also received 2 silver statuettes for the Caribbean's Best Cruise Destination and Best Wedding Destination. Director of Tourism Donovan White says the awards are a gratifying and welcomed recognition for the Jamaica Tourist Board team. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.